evening, Chicago. Welcome to another spring edition of Social Security Hotline 21. My name is Rocio Roman Oquendo. I am a claims specialist at the Social Security here in Chicago, located at 2127 West Lawrence Avenue. And I will be your host for today's program. With me in the studio is my guest, Paul Conchaldi, and our phone technician for today's program is Maribel Marquez. Paul, please introduce yourself.
Thank you, Rocio. I'm Paul Conchaldi. I'm a claims specialist at the Chicago Near Southwest office located at Adams and Racine. I'm also the homeless coordinator for our office, and I work with a lot of the hospitals in the medical district.
And we want to remind our viewers that you are watching a live interactive call-in program brought to you on CAN TV 21 to discuss Social Security matters. We invite you to call in with your questions. The phone number in the studio is area 312-738-1060. One more time, the phone number here in the studio is area 312-738-1060. The phone number will remain at the bottom of your screen, and our phone lines are open. So while we're waiting for your calls, we will get started in our topic today. Paul, did you know that to help combat the rising threat of fraud and identity theft, Social Security no longer issues Social Security number printout? And if you need a verification of your Social Security number and you cannot find your Social Security card, you must apply for a replacement card?
Yes, that's very important. One of the things we try to do at Social Security to prevent identity theft is limit how many times we can give out a Social Security card, how many times we give out any kind of information with your full Social Security number on it.
And in the event that you really want or need a replacement card, either for yourself or for a child, you can find all the details you need at the Social Security number and cards page at www.socialsecurity.gov/SS number. This page provides information on how to obtain a replacement card and what the specific document you need to provide.
Yes, so basically we need something that proves who you are. The easiest things obviously is a state ID card, a driver's license, passport, things like that. For children, we also would need something that documents that you have custody of the child. In other words, that the child lives with you. Lease, for example, school records that list you as the parent to call, things like that.
Perfect. And remember, whether you need a Social Security card for yourself or for your child, it's easy and it's free to apply for one, but consider whether a new Social Security card is really in the cards for you. It may be that your card is already with you in your head.
Be sure too that, just because it's old, you don't need a new one. Okay? The number will always be the same. One of the things we have is, people carry them in their wallets. Well, don't do that. Don't carry your Social Security card in your wallet. Keep it at home, someplace safe. You don't need it all the time. You need it maybe if you're starting a new job, or you need it for some other type of public benefits. But most of the time, you don't need to carry it around with you, and we really strongly suggest that you don't. If you lose your wallet or lose your purse, and you lose your ID and your Social Security card and everything like that, getting all that stuff replaced these days, in the days of post 9/11, is very, very, very difficult, and you really don't want to do that.
Now, Social Security provides 2 top-rated online tools to help you plan for your retirement. First is the Retirement Estimator, which give you immediate and personalized retirement benefits estimates. The Retirement Estimator is convenient and secure and let you create what-if scenarios. Like, for example, you can change your stop work date or expect future earnings to create and compare different retirement options. If you have a few minutes, you have time to check it out at www.socialsecurity.gov estimator.
Exactly, and the more that you think about it, or the closer we get to that time, you want to look at and realize that there are how much will I get if I retire this year? How much will I get if I retire next year? What's the difference? What happens if things change? What happens if I get sick? There's a lot of changes to think about, but it also gives you a good way to plan to see, how much am I going to really get from Social Security, so you can figure out what other savings plans, what other investment vehicles you may need to make yourself very comfortable in your retirement.
As you can see right now on the screen, we are showing you the website for Social Security Administration, and this is the retirement estimator. In here you can sign in or create an account. That is very helpful for people who are currently receiving Social Security benefits, because if they have to do a change of address, change of phone number, change in the direct deposit information, they can do it here without the need of going to a Social Security office and be waiting for who knows how long at the local offices. Also, if you need a benefit verification printout, you can also sign in into your account, and you can get it from home, and you can avoid the unnecessary waiting at the local field offices.
And that's a very good thing, because also a lot of people need want an estimate. Sometimes your financial planner will want the estimate. Also, you may need it for your own idea as to how much you're going to need when you retire, how much the benefit is. Should I retire this year? Should I retire next year? What the difference is going to be. Again, there's a lot of different things that they can do, and we can talk about. And this is a good way to play around with it and see, well, if I retire this year, how much will I get? Well, what if it's next year? Well, what if it's 6 months from now? And you get different numerical values, and then you can realize, well, is it worth it? How do I feel? What's my health like? And those are the kinds of things you need to also be cognizant of when you're talking about retirement. The other thing that's very important to think about when you're thinking about retirement is your insurance. People get Medicare at 65, but if you retire at 62 and you get sick, how are you going to pay for your medical bills? How are you going to pay for your medical care? These are very important concerns that you need to think about as you contemplate, when I should retire, what my retirement date should be.
And just remember, we are always available if you have any question or concern in regards to your future, in regards to disability or retirement benefit. What else?
We really encourage everybody to go online and check it out, because a couple things may happen. One is, maybe we're wrong. Maybe we missed a year or two. Maybe there's a gap. Maybe we only have one of your jobs that year and you worked in 2 different places. Maybe something's not right. This gives you time now to fix it before you actually get to the point where you need to retire. It also gives you an idea, again, so you can plan and think about what the results are going to be and how much you're going to be able to live on. It's a very difficult thing. It's a very traumatic thing as you think about retirement. But on the other hand, it's also a joyous time too, but you need to think about how much your benefits are going to be, how much you're going to get when you retire, and what the options are.
And then, as you can see here in your screen, there are, one more time, the website for Social Security Administration. And here is if you want to file for retirement, you click in retirement or disability. Also about how to get to know your Social Security, the online services that we provide. Here down, you can check your Social Security statement. There is this is the site you want to go. You want to click here, because here in My Social Security, You can is when you can actually check your work history and find out if everything is correct or if there is any gap, any missing earnings. All that information is here. So
Also, we are call-in shows, so if you guys have any questions, any concerns, things you don't understand, give us a call. Our number right now is 312
738
1060. Okay,
Yeah,
there you go. 312-738-1060. So if you guys have any questions or concerns about Social Security, we don't want to get into any one specific individual case at this point, but we can certainly talk about what's going on, things that are happening. Also, we can give you general ideas about policy and what the rules are on specific things. So, we can talk about that too if you need to. Again, 312-738-1060.
And Paul, let's talk a little bit about Medicare. So Medicare provides health insurance to more than 50 million Americans. 42 million are people aged 65 and older, and the other 8 million are younger and have disabilities. Most people first become eligible for Medicare at age 65.
Exactly. And when you're 65, you become eligible for Medicare. Also, if you are on disability, if you are disabled, in other words, you get SSDI benefits, or you get those, you get Medicare 2 years after you become disabled, after you become entitled to your benefits. The other option is if you're on kidney dialysis, or if you have Lou Gehrig's disease, you may be eligible for your benefits, for Medicare benefits a lot earlier. So again, check into those things as soon as you can, and we can look. You might be eligible for health insurance.
Now, the 4 parts of Medicare are Part A, B, C, and D. Now, Part A is hospital insurance. It helps cover inpatient hospital care, skilled nursing care, hospice care, and home health care. Most people get the Medicare Part A premium free since it is earned by working and paying Social Security and Medicare taxes.
Yes, and again, think about this as if you're in the hospital. If you're in the hospital, where you spend the night in the hospital, this is what Medicare Part A pays for. It pays for in a nursing home, in hospice care. Those kinds of things are what Medicare Part A pays for.
And also pays in situations like, for example, if you go to the emergency room, but the condition that brought you there is serious enough that you have to be hospitalized, that emergency room visit will also be covered under Part A of Medicare. Now, Part B, it's also known as the medical insurance. Basically, that helps cover service from doctors and other outpatient healthcare providers, outpatient care, durable medical equipment, and some preventive services. Most people pay a monthly premium for Part B. In 2017, the monthly premium for most people is $134. Now, people with some high income, they pay more than the standard premium. Your Medicare Part B premium also can be higher if you do not enroll when you are first eligible, also known as your initial enrollment period.
Exactly, and what happens with Part B Medicare, again, think of Part A as if you're in the hospital, think of Part B as if you're out of the hospital. So you go to a doctor, you go to your doctor's office and go home. You go to an outpatient clinic at a hospital. You go to dialysis and go home. So things that are, excuse me, outpatient care, that's what the Part B is for. The biggest mistake I notice that so many people make is they go, well, I can't afford that. That's $134 a month. But then they go, well, I don't need that because I'm not sick. Well, the problem with that is you're going to get sick. You can't buy fire insurance after the fire. Okay? So you want to be sure that you can do as much as you can ahead of time. There's a 10% penalty for every year after that that you don't take Part B Medicare. You decide you want it when you're 70, that's 50% more than you're paying now. And that's going to be very, very difficult. And unless you're of independent means, well, you can just write a check for your doctor's care. I strongly advise everyone to take the Part B Medicare. You're going to need it. You're going to go to a doctor sometime.
Yes, and as I always say, is like I always compare like with homeowner insurance or car insurance. Everybody who has a house or own a vehicle, we have to have the proper insurance, and at the same time, we're always crossing our fingers that we don't need to use it, but it's better to have it and not use it than need it and don't have it.
Exactly, and the costs are astronomical, and so many times I see seniors in the hospitals where they don't have this care and they need it, and they've really got to work on it. Also, for our low income, for a lot of people with low income, this $134 may be paid for by public aid. So if you have a public aid medical card, if you're eligible for Medicaid, which is a public aid medical card, they may be able to pay that for you. So it won't have to come out of your pocket. But again, you need to check with public aid. You might be eligible for that. And then that way, the Medicaid pays for what the Part B doesn't pay for, and it pays for the Part B premium for that. Exactly. So the state may be able to help you with that on a lot of different areas. Guys, remember, if you have any questions about this, please call 312-738-1060. We're ready for your questions.
Yes. Another, in addition to what you just said, Paul, is just, I have seen a lot of instances where a person comes to our office and they say, oh no, I don't want Part B because I have Medicaid and I don't need Part B. And that is incorrectly. So as you mentioned, if you have Medicaid, it would be better to go to the public aid office and find out if they are going to be able to pay for your Medicare Part B premiums. Sometimes people go, they don't want Part B because they don't want to pay, but sometimes public aid may stop the Medicaid if the person being eligible for Medicare refuse because of the premium. So
also, this is also people on county care. County care is a new program. It's just been in the last couple of years, but that could change. And again, if it changes and you're left without insurance, that's not going to help. You know, you're going to be responsible for paying that extra premium. A lot of workers for the city of Chicago got caught up in that this year when the city decided they weren't going to pay for insurance anymore. So they didn't pay their Medicare premium. So again, they're going to pay a 10% penalty for every year they didn't take it.
Now, the other part of Medicare is Part C. Part C, it's also called as Medigap or Medicare Advantage, Medicare Supplemental, and this Part C allows you to choose to receive all of your healthcare services through a provider organization. This plan includes all benefits and services covered under Part A and Part B, usually includes also Medicare prescription drug coverage, and may include extra benefits and services at an extra cost. You must have Part A and Part B to enroll on Part C. Monthly premiums vary and depends on your state, private insurance, and whether you select an HMO, Health Maintenance Organization, or a PPO, Preferred Provider Organization.
Usually what happens with this is that the Part A covers pretty much the whole thing. You're in the hospital, they'll pay. Part B covers 80%. So who's going to pay for the other 20%? This is where you get what's called a Medigap insurance or a Medicare supplement. These are a lot of the things you all see on TV from various insurance companies. They want to sell you their products. Most people should have one of those. If you don't and you're eligible for Medicaid, Medicaid will be your supplemental insurance. But there are ways that you can do this, and Part C is basically, if you're going to think of it like an HMO. An HMO covers like everything, but you've got to go to their doctors. A PPO is a preferred provider. In other words, we want you to go to our doctors, but if you don't want to, it's okay too. But there's a higher deductible. There's a higher payment that you need to pay for that. And that, again, is going to help. That's going to increase your costs when you go to the doctor.
Now, Part D. Part D is the Medicare prescription drug coverage, helps cover the cost of prescription drugs. Many people pay a premium for Part D. However, people with low income and resources may qualify for extra help from Social Security to pay the premium and deductible. To see if you qualify for extra help, visit www.socialsecurity.gov/prescription help.
Great. Seems we have a caller.
Yes. Good evening. I was just wondering, because the last 2 years I haven't gotten a raise. You know, it's been the same thing 2 years in a row that my Social Security didn't go up.
Okay.
The same. I was wondering if this year's going to be the same. Are they going to finally give us a raise?
Well, that comes from Congress, okay? So Congress determines what the raises are. We really don't have anything to do with that. It also goes by a cost of living adjustment. They passed a law a few years ago that Social Security benefits would go along with the cost of living adjustment. Anything more than that would have to go through Congress.
And
So we don't know.
Thank you, sir. I appreciate it.
Yeah. So talk to your congressmen and your senators. I mean, this is one of the things people talk about with Social Security. You know, like, will Social Security be there when I turn 65? Sure, it'll be there, but what will it be like? People are talking now. If you watch TV today, it talks about Social Security benefits and what they want to do and what they want to add, what they want to subtract, and what they want to change. It's very important. People need to be informed, and part of our job here is to inform you about what Social Security is today, and if you like it or don't like it, that's where then you need to contact your elected officials, your congressmen, your senators, and they can help you either work on to get more benefits or less benefits or whatever your desires are to help you get the benefits that you need from your taxes.
And just for a clarification, there was a cost of living increase last year. It was the 0.03%, but also the Medicare premiums were increased. So probably that's the reason why most of our claimants didn't see actually a raise in the benefit amount, but there was a very small cost of living increase. So we'll see at the end of the year what happened, and if something happened, you will be notified by mail. Well, Paul, it looks like we are running out of time. What that means is that we will not be able to take any more calls on this edition.
We have one caller. Let's take the last one and
Okay,
see
caller.
where. Hello? Yeah.
Yes, my husband passed in 2014, and I'm trying to get his benefits, and how much you have to, and I'm still working, so there's an amount that you have to make so you can get his benefits.
From your spouse?
Yes, he had passed 2014, and I want to see if I can get his benefits. But I'm still working, but they said I made too much to get his benefits.
Okay, all depends on your age. Remember that if the person is under full retirement age, which currently is 66, if the person is working, this person will be subject of the annual earning test, which this year limit is 16,920. So if you're working and you're earning more than that, that is the reason why the amount of your earnings will prevent you to be able to receive monthly checks. But if you have any question, go to the office and you can request a detailed explanation. So,
Okay.
Thank you for your call.
Thank you.
So, Thank you so much for everything. On behalf of our hotline team, Rocio Román Oquendo, your host, my guest Paul Conchaldi, and my phone tech Maribel Marquez, we want to wish you, each of you, a very pleasant and safe evening, and be sure to tune in again in next weekday, Wednesday, for another edition of the Social Security Hotline. Good night.